Health officials say a summer COVID surge is here.
Chanley Painter tells us about the new recommendations for vaccines.
As summer begins, health officials are already looking ahead in their efforts to fight new coronavirus variants. The Centers for Disease Control and Prevention is recommending all Americans to get new vaccination shots this fall.
Essentially, the change with COVID is that there's an updated formulation. Everybody over the age of 6 months should get vaccinated for COVID and for flu.
The decision follows last month's numbers that show COVID-19 deaths and hospitalizations neared the lowest levels since the beginning of the pandemic in 2020. But rising COVID cases in parts of the country are bringing back some concern.
The SARS-CoV-2 virus that causes COVID is a very quickly evolving virus.
The Associated Press reports fewer than 25% of adults in the U.S. were up to date on their vaccinations last month. But Lauren Ansel-Myers, a COVID-19 researcher at the University of Texas in Austin, says vaccinations for COVID and other illnesses are needed in the early fall when the diseases begin to spread.
These respiratory viruses like RSV and influenza and COVID, they still take an enormous toll every year.
The CDC is also updating its RSV vaccine recommendations for older adults.
All individuals over age 75 get the RSV vaccine for the upcoming 2024-2025 respiratory virus season, and that any adults between ages 60 and 74 who have underlying conditions that put them at high risk for severe RSV, they should also be vaccinated.
CDC Director Mandy Cohen signed off on the recommendation on Thursday, with the new COVID shots expected to be available by September. I'm Chanley Painter, Fox News.